Hi everyone, I'm Sherry and this is Mom Moments. I said I was going to give you guys a little update of what's going on this summer in the last video, so I figured now would be a great time. So basically my middle son has been diagnosed with bipolar. He already has ADHD combined type and has been pretty severe. As you know, all of my children are adopted, so we do not have like the full medical history of his family history. So it's kind of hard to try to basically get things where they should be, where he can get the medication that he needs, considering that he is 10 and a half years old, and a lot of doctors consider that young to be diagnosed with bipolar, but bipolar has a genetic component, so it can come out at any year, any age. Just because they have it in their book that it usually comes out between 18 and 21 does not mean that, you could have a case where you're seeing signs at like 5, 6, 10, 12, 15. Like, it can come out really at any time. With my son's issue, he was born drug exposed and has a couple other medical issues that play into it. So that basically what it does is it can make it come out earlier, and it can also make it more severe. So we have been dealing with this probably almost a year now, where he's been in like crisis mode. Of course, he has a crisis, he acts out, he'll attack someone, he'll break things, and then just as quick as it comes and he's in a meltdown or manic moment, it goes, basically. So like, if we call the police, by the time the police get there, either he understands at that point and it is in a right state of mind that he understands that, like, oh, I'm gonna get in trouble, and he can switch it off and turn, not act that way anymore. Or his bipolar's basically, the manic moments basically ran its course, and then he's acting normal. So he's not showing a crisis like to the police, or by the time we get him to the ER for behavioral health eval, he's not showing any crisis. The crisis is already come and gone. He's already done the damage of breaking things or hurting people. So we've been kind of managing this as best we can from like January. And to be quite honest, as a parent, I am extremely exhausted. I have to keep on him. I have to, watch him all the time. Make sure that he's not doing anything that's dangerous to himself or trying to attack anyone else. And it's completely exhausting. I have 2 other children, as most of you know. So it's getting to the point where it's affecting them. They're afraid to come out of their rooms. My son starts showing any kind of sign of getting himself into an episode, and both of them, like, literally automatically run to their room and close the door. It's sad. It's upsetting. It's, kind of obnoxious also, because like, now we're trying to get him the help that he needs as best we can. He already has a care manager. He has 2 therapists, an in-home and an out-of-home therapist. He also is currently working with a BA. So basically, in our state of New Jersey, we have all of the services for mental health that we can for my child. He's on medication. Apparently not the correct medication for bipolar, which we are having a lot of trouble trying to find a doctor that will treat, psychiatric children, that will give him the medicine that he needs for bipolar, because for whatever reason, they do not want to diagnose him on paper as bipolar. He is diagnosed as DMDD. And I'm told that is basically, you have a child that's acting out. You have a child that's having a mental issue, but not to the extent of bipolar. It's basically an unclassified issue where they think it's more their behavior and, they're choosing to act out, and not that they have an actual, medical issue in their brain where there is a medication, such as bipolar, that he can take that will help him. It's pretty easy once you're 18 or older to go to the doctor, get your evaluation, get on the right medication, and then it's just a matter of changing the medication, if it may not work or something may work better, or upping the dose or that kind of thing, where you kind of play with things, but the direction that you're going in, the answer of how to help the person as best as possible. In my son's case, we don't have any of that because he's a child and they don't want to treat him with the proper medication because he's not, the age that it says in their medical books that he should be treated for this. So we are doing the best we can. Just, wanted to give you guys an update on what's going on. And I wanted to reach out and see if there is anyone that is dealing with anything similar like this, any kind of mental health issue with their child. What are you doing to try to push and get what your child needs? What services have you used? And especially if you're in New Jersey, I would greatly appreciate it if you could tell me the contact information for a good child psychiatrist, because I have went through about 15, 20, and I'm not finding anybody that is willing to listen and actually understand what is going on with my child. Therefore, people are, basically failing my child at this point. And it is, made life really horrible in my house, to be quite honest. So thank you for listening, and I will talk to you guys soon. Bye.